So, you have an ACL injury. As with any injury, there are many questions to be answered. What is an anterior cruciate ligament? And what can you expect as you work towards recovery? This educational video will briefly cover aspects of the treatment of an ACL injury from diagnosis to outcome. So let's get started. Anterior cruciate ligament, or ACL for short, controls the movement of your knee joint. It limits the side-to-side motion of your leg and prevents your shin from moving too far forward. Finally, it keeps you from extending your knee too far back. Therefore, hyperextension of the knee, or severe force when the knee is partially bent, can result in a tear of the ACL. If you have torn your ACL, what kind of symptoms are you going to feel? Well, you might hear a popping noise when the injury occurs, as well as pain and swelling. Later on in the course of your injury, you may experience some knee joint instability, and perhaps arthritis. It is important to see a healthcare professional, like a physiotherapist, to help you recover in the best way possible. A physiotherapist can diagnose your knee injury. They commonly use 3 types of tests to diagnose an ACL injury: the anterior drawer test, the Lachman test, and the pivot shift test. The most common of these is the Lachman test. The Lachman test is done with a patient lying on their back, with their injured knee flexed at about 30 degrees. The physiotherapist will put one hand on the patient's thigh and the other on their shin. They will then push the shin and measure how much movement occurs. If there is a soft feel and more movement on the injured side compared to the non-injured side, this is considered a positive test. The anterior drawer test is also done with a patient lying on their back. The hip on the injured side is flexed and the knee is also flexed at about 90 degrees. The physiotherapist will stabilize the patient's foot with their thigh and put both hands behind the calf with their thumbs resting on the patient's shin. The physiotherapist will then apply a force and compare the amount of movement between the patient's 2 knees. If the injured side moves more than the non-injured side, this is considered a positive test result. Finally, the pivot shift test is also performed with a patient lying on their back. The physiotherapist will hold the ankle of the patient's injured knee and turn it inward while also applying pressure to the outside of the knee with their other hand. The physiotherapist is once again monitoring the amount of movement at the knee in order to determine if a tear is present. In addition to these common clinical tests, you may also have a magnetic resonance image, or MRI, performed. Studies have shown that the best image for diagnosis uses an oblique coronal angle. Another method of diagnosing ACL injury is with knee arthroscopy. For this method of diagnosis, an orthopedic surgeon will make an incision and insert a scope to get a good look at the inside of your knee. It has been shown that clinical tests are just as good at diagnosing injury as MRI and arthroscopy. Therefore, these additional diagnostic tests may not be required. Now that you've been diagnosed with an ACL injury, what happens next? The next question will be whether or not you require surgery. If you do require surgery, you may be asked to do some pre-operational therapy. This therapy is aimed at strengthening your legs to encourage a better outcome. There are 2 types of quadricep exercises, which can be done and should be done in combination with one another. The first type of these is called open chain kinetic exercises. In this type of exercise, the foot is free to move and the knee joint is working independently of all other joints. An example of this type of exercise is knee extension. The other type of exercise is known as a closed chain kinetic exercise. In this type, the foot is fixed and the knee joint moves with the hip and ankle. Some examples of these are squats or leg presses. In addition, there are 2 main types of reconstructive surgery. The first type of surgery is patellar tendon replacement. In this procedure, a part of the tendon on the front of your knee that connects your kneecap to your shin bone, called the patellar tendon, is used to repair your torn ACL. The other option for surgery is a hamstring tendon replacement. In this procedure, a tendon from one of your hamstring muscles on the back of your leg is used in place of the torn ligament. Following surgery, your physiotherapist will have you begin a rehabilitation program. The exact program will vary between professionals, but there are some important guidelines all programs should follow. If you do not require surgery, your rehabilitation program should still use these same guiding principles. Within the first couple weeks following surgery or injury, it is important to do exercises which will help you regain the range of motion in the injured knee. Following the initial range of motion exercises, the focus should shift to strength training. There are a variety of different exercises that can be used to help you regain your strength and will vary between physiotherapists. Neuromuscular training is also an important aspect of your rehabilitation and can start to be incorporated shortly after the initial strengthening phase. This can include things like balance, plyometrics, agility, or sport-specific exercises. No matter what the specifics of your training program, it is important to keep in mind that you are an individual and your healing process is unique to you. Keeping this in mind, don't be afraid to accelerate your program as you progress. If you are ready to progress in your program beyond what is outlined for you, and it is deemed safe for you to do so by your physical therapist, don't be afraid to go ahead. Everyone is different and will reach distinct milestones at their own pace. When you have an ACL injury, there are many things that you can take into consideration to improve your long-term outcome. It is important for you to get educated on the nature of your injury. Viewing educational videos, such as this one, or reading relevant literature can help you become informed on the type and course of your injury. Being informed is an important step in your recovery. Letting yourself gain in excess of 15 pounds may be detrimental to your overall recovery. Stay conscious of your weight and remain as active as possible to avoid hindering your healing. It is not uncommon to have to reduce your pre-injury activity levels. Certain activities, such as contact sports, put you at a greater risk for subsequent trauma and re-injury of your knee. There is often a greater reduction in recreational activities in women than in men. It is important to stay positive throughout your rehabilitation process. Your age does not have to affect your outcome. Whether you are a young adult or a middle-aged individual, your long-term result can be just as positive. It is important that you take control of your own recovery. Only you are responsible for your outcome. As you learn more about your ACL injury, you will have many questions and concerns. Each ACL injury is as unique as the individual who sustains it. It is important to keep in mind that a healthcare professional, such as your physiotherapist, can answer many of your questions. Common questions from patients with ACL injuries include those regarding surgery and the preoperative period, the postoperative period, rehabilitation, and the progression through it. When seeking advice from outside sources, such as the internet, you must be sure that the source is reliable and that the information is applicable to your individual case. The best person to ask is a healthcare professional that is familiar with your case. Following your injury, you may want to know when you can go back to work. There are several factors that will push or pull you towards returning to work or not. These factors may include your financial situation, pain from your injury, flexibility in workplace demands, and employer support. Again, it is important to look at all aspects of the possibility of return to work in order to make the best decision for your unique situation. We hope that this educational video has been helpful as you seek information about your injury. Remember, if you have any additional questions or concerns, do not hesitate to ask your physiotherapist.